So here are two conditions that people often ask about how they can tell apart. One is frozen shoulder and the other is a rotator cuff tear. If you want to find out how to tell the difference between the two, let's dive in. Hey guys, Khalid here. Welcome back to Clinical Physio. So, how do we tell the difference between frozen shoulder and a rotator cuff tear? Well, the real first thing that tells me the difference between the two is asking ourselves the question, what is the patient's main symptom? So with a frozen shoulder, you may well find that your patient's main symptom is stiffness based because frozen shoulder is a stiffness based condition. We split frozen shoulder into two distinct phases. The first is a pain dominant phase. This can last anywhere from 6 to 9 months. As you can imagine, patients will have a progressive worsening in pain, but they will also have a progressive worsening in stiffness of the shoulder. The stiffness dominant phase, which can also last from anywhere from 6 to a further 9 months, is where the pain starts to subside, but their stiffness remains. And as you can hear in both scenarios, stiffness is the key word. So in patients with frozen shoulder, we find that stiffness manifests itself the most in the external rotation movement, where patients are often limited to around about 10 to maybe 20 degrees of external rotation. And crucially, that external rotation loss occurs in both an active and passive range of movement. Of course, we'll also find that they struggle with flexion, that they struggle with abduction, and of course medial rotation, which we sometimes measure with hand behind the back. But a loss of external rotation is the key stiffness finding. So with a frozen shoulder, the main symptom is stiffness, and with a rotator cuff tear, the main symptom that your patient presents with is weakness, particularly if we're talking about a large or massive rotator cuff tear, not an incy-wincy cuff tear. So as a result, you may well find that the patient's main troubles come on active and resisted movement testing, because these movements will be testing the tendon and therefore the power of the shoulder. With a frozen shoulder, we tend to find that resisted tests are less affected because the tendons are still intact. So whilst patients presenting with a large cuff tear may have a clear restriction in their active range of movement and their resisted tests, you may find that actually their passive range of movement is preserved because the tendon doesn't need to be active during passive range of movement in order to generate motion. Now, of course, this is another major difference between a cuff tear and a frozen shoulder, because with a frozen shoulder, as we said earlier, we expect both active and passive range of movement to be restricted. So it's crucially important that we test these ranges of movements in our patients. Now, we said in terms of frozen shoulder that patients will find that their symptoms gradually get worse over a period of time. However, with a rotator cuff tear, there is a sudden change in their range of movement because the tear normally happens following a trauma, particularly in the older age group. So that is another key difference between the two. So guys, if you want to improve your clinical assessment skills at the shoulder, we have loads of resources on Clinical Physio membership here to help you, including webinars such as differential diagnosis of the shoulder and common shoulder conditions to really help you build on your knowledge and skills. And if you want a link for Clinical Physio membership, it's in the description below so you can check it out. For more, make sure to subscribe to the channel and check us out on Instagram at Clinical Physio, where we have loads of other brilliant resources for growing physios. Otherwise, I'm Khalid. Thank you so much for watching. See you really soon here on Clinical Physio.